there's all kinds of childbirth methods out there. And we're all getting bombarded with all these fancy little, you know, hypnobirthing and hypnobabies and Bradley and birthing from within. And I mean, I could just go on and take up the whole class, mentioning all the names. And there's all these cute little names for the birth centers and the midwives' businesses and, you know, things like that. And basically what I'm teaching in this class is just birth. I have been attending births since 1985 when I attended my very first birth, and that was the birth of my niece. My sister asked me to come to the hospital and help her have her baby. And I had been studying to be a midwife. I had taken my college classes and reading everything I could get my hands on. We didn't have internet back then, so I had to go to the medical library after I was done reading all the books in the county library that had to do with childbirth. But that was the very first time I ever saw a baby come out of a woman's body. It was in September of 1985. 2 months later, I finally was able to talk my mentor into training me to be a midwife. And she had had a lot of bad experiences with her apprentices in the past and just had vowed that she'd never train anybody again. Had a professional birth assistant, and I talked her into it finally after several attempts at persuading by asking her if she would pray about it. I said, if you pray about it and the answer is no, then I will leave you alone. So she prayed about it. We aren't even the same religion, so it was kind of shocked her a little bit. But she called me 2 weeks later. I got a phone call, and I picked up the phone, and I hear, I know I'm going to regret it. And I said, so you prayed about it? Yes, I did, and I feel very strongly that I should train you. But I know I'm going to regret it. And I said, okay, when can I start? And I was living up in southern Utah at the time. And we started packing up our things. I said, give me 2 weeks to pack up and come down there. So we went down to Las Vegas, where I began training 2 weeks later. I called her up and I said, okay, I'm here, I'm ready. And she had prenatal days on Tuesdays and Fridays. This was a Tuesday. I said, I'm ready. And she said, okay, come on over. I start at 9 o'clock. And I said, okay, I'll be there. So I get a phone call at 8:30, and she said, have you left yet? And I said, no. She says, can you stop and pick up a girl who's in labor on your way to my house? And I said, sure. She says, yes, she's going to be delivering at my house. She's quite poor and doesn't have a car to get over here, but if you can just go pick her up. So she gave me the directions, and I drove over there to this apartment complex in Las Vegas. And as I pulled up, this Hispanic man came out on the balcony, and he goes, hurry, 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 like this. And so I ran up there and walked in the door just in time to see her walk out of the bathroom and a baby fall out between her legs, and her friend caught it because I was across the room, so I wasn't able to get to it. So with that, I just ran up and I said, okay, well, why don't you lay down over here? And I called up my mentor and said, well, the baby fell out as I walked in the door. And she said, okay, can you come over here? She says, as soon as I get there, can you come over here and do my prenatal appointments for me? So this was my initiation, my very first day on training, and a baby fell out right in front of me, and then I had to go and pretend I knew what I was doing, measuring women's bellies, listening to the heartbeat, taking their blood pressure and everything. Now, I had had some training in nursing school, so I was able to fake it a little bit, but as we bypassed each other, she said, if you need to do a vaginal exam, just act like you know what you're doing and tell them they're progressing beautifully. I said, okay. So time went on, and we practiced very differently back then. We midwives did. We were very, very hands-on. Now the trend is going towards hands-off. And I don't so much favor some of the ways that the movement is going. I think what's happening is you have a lot of midwives now that are being trained in classrooms, because just like my mentor was not going to train anybody else, a lot of midwives feel that way. They just don't want to train anybody else. So finding an apprenticeship is hard. So you have these schools that have opened up all over the country where women go and they learn in a classroom setting. In that classroom setting, there's very little opportunity for hands-on experience. So when you're wanting to, they have to have so many births as an observer and so many births as a primary caregiver. So as an observer, it just means you go in and you observe the birth. Well, okay, so a midwife, I know midwives who were part of the training process and had schools, and they would bring 4 or 5 of these students to every birth. And one of the students, everybody would stand around and watch, and then one of the students would have the privilege of catching the baby, and another student would have the privilege of catching the placenta. Now both of those students were able to say, I'm a primary caregiver. Now, as an apprentice, I was there through every prenatal with these women, shadowing my mentor. And once it came time for the baby to be born, oftentimes I was left to labor sit because she was a very busy midwife, sometimes delivering 20 babies a month consecutively every month. She did an average of about 100 babies a year. So quite often I was left to labor sit, and that's where I really learned a lot. But we did a lot of vaginal exams back then. Vaginal exams gave us a lot of information. Sometimes I would be examining a woman almost through her whole labor if it was very difficult labor, because there was a lot of things we could learn then. It was how strong are her contractions? How effective is this position that she's in? Because you could tell by a vaginal exam if the position was effective, because you could feel the baby descending, you could feel the cervix opening up. And with all those vaginal exams, it was quite often that a woman would say, I'd pull my hand out and she'd say, get your hand back in there. It feels good, because I would put my fingers on either side of her cervix and I'd say, okay, right there. Do you feel where I'm touching? Yes. Relax that and bring the baby right through there. And it gave them something to focus on, and this was usually women who were really kind of losing it in childbirth and not being able to keep their composure. Sometimes I would say, okay, here, let me do this. And I said, now right there, focus on it. And it would totally bring their focus, because when you touch somebody, they focus on where they're being touched. The human touch is very, very powerful. And as a midwife, when I touch somebody, if you're in labor and you're in a lot of pain, if I reach out and I touch your ankle and just hold your ankle firmly, it literally draws pain out of you. It really does, just to have somebody touch you. Now, for example, to illustrate that, your husband comes and puts his arm around you when you've had a bad day. Or you're going out for a date, you're in the car, and he just reaches down and puts his hand on your leg. Can you feel the energy exchange when something like that happens? Just the touch. Have you ever felt a negative energy exchange when somebody touches you? Have you ever been around somebody who you want to stand away because the energy is just sucking you dry. There's a lot of pain relief in the touch of a midwife and of a spouse when you're in labor. And we'll talk a lot about that in this class. So we did a lot of touching. We did a lot of vaginal exams. We did a lot of moving women around in different positions. And in doing that, I've learned a lot about the cervix. I have literally felt with my own fingers the cervix as it's dilating and as the baby is rotating and coming down through the pelvis. Nowadays, I would be called a birth rapist for doing that. But this was imposed upon the women. This was things that this was acceptable in childbirth. They came to midwives who knew how to do that, and the granny midwives still know how to do that. So I try to train my apprentices in how to do that, but they're the exception, not the rule. So, but now at my age, in my 50s, I don't have to do so many vaginal exams because I can tell by the way she's acting what's happening inside her, because so many times I've felt it and could correlate it and learn by the way women are acting at that time. However, I still on occasion will ask, a woman who's just not doing well with her transition, I'll say, would you like me to try this technique where I touch your cervix and give you and help you to focus on it? And they give me permission to do it. I do it, and they beg me to keep my hand in there on every contraction, even sometimes screaming at me, "Get your hand in there." So to me, when a woman's screaming, "Get your hand in there," I don't think that's birth rape. But I actually had a client come in the other day who said, aren't vaginal exams dangerous? And I thought, how has this gone so far from a loving midwife's touch and getting information that helps her to move her labor along, to birth rape and now dangerous physically. I don't know anything about it that's dangerous if it's done right. But it's completely up to the woman what they want to do. But I always give you the option. But the reason I told you that about vaginal exams is I want you to understand where I'm getting my information that I'm going to teach you in this class. Okay? So, I've learned in teaching many, many women over the years that you have to understand the anatomy and physiology of childbirth before you can really focus on what's happening and help yourself through this labor. It's like the weightlifter, and I always go to the weightlifter or the marathon runner. Okay, when there is pain, they know it's working. So what has the weightlifter and the marathon runner learned to do? They've learned to love pain, the right kind of pain. And I remember in high school I had a science teacher who was a marathon runner, and he used to talk about the high he got from the pain and how much he loved the pain. He says you run and you run and you run until you feel the pain. And they love it. Now there's people who hate running, and I used to be one of them. I kind of like it now. But they hate it because it's painful. Now childbirth is a lot bigger reward than muscles or a medal at the end of a marathon. It's a lot bigger reward to have this beautiful little person in your arms that you felt, that person, you felt your body contracting, you felt that person reacting and maybe moving with those contractions. You felt that person rotate through your pelvis. You felt that head crown, and you felt the burn of your skin stretching. And then you felt that head pop out, and what a relief that was. And then you feel that head turning and rotating as he's getting ready for his shoulders to come out of the pelvis. And then he comes out and he comes into your arms. You did that. This is your medal. This is your muscles or whatever, your reward is this baby that's right here in your arms, and you felt every minute of it. You and him did it together. And that's what's so neat about it. And when you think about it that way, the pain feels good. And so I'm going to teach you not how to hypnotize yourself out of the pain, not how to get an epidural and just be one of the bystanders on the sidelines who says, yeah, run, yeah, you're doing a good job, to the marathon runners as they run by. But I'm going to teach you how to be an active participant in your birth and enjoy it and love the pain. Do you believe me? We'll see. We'll see. You'll tell me when you're done. Because I see women getting up in my classes and telling their birth stories and crying. Have you seen it at my classes? They get up and they can't help but crying because it was such a magnificent, beautiful experience and so empowering and strengthening, and they are a new person when they're done. Now, epidurals, great modern technology. I'm glad we have them in those situations when we need them. But there is always a price to pay. When you give up something, you're giving up something else. So when you're giving up the pain in childbirth, you're giving up the good feeling, the most beautiful feeling that a woman will ever feel. And that's the feeling of having a baby pass out of her body and into her arms. She will know that baby better. She'll be more protective. She'll be more connected. She's not going to love the baby anymore than a woman who gets an epidural. They still love their babies. Everybody loves their children. But she's going to be able to read their mind better. She's going to understand what this cry means and what that cry means better than anybody else because she connected with that baby when they went through labor together. And when you get an epidural, the baby still has to go through labor. But mom is oblivious. Mom's watching TV or playing cards with her husband or something and watching the monitor and waiting for the nurse to come in and say they're dilated a little bit farther. But the baby's still going through it. And when she's got that epidural, there's a couple of things that are happening or not happening. When she gets a contraction, what does a mother do with natural childbirth? What comes naturally when you feel that contraction coming on? Do you know? Think about it, those of you who've had babies. Very first thing you do, you feel that contraction coming on, and what do you start doing? You're about to say it, Katie, you just don't want to be wrong. She goes, she knows because she's remembering her natural childbirth, where the first thing you do is you take a breath. And then you start breathing heavier. That's nature. That's nature. Your body is naturally starting to breathe heavier when you're having a contraction. Why do you suppose that is? What are the benefits? What are the, cameraman, what is it?
The baby needs more oxygen.
Right. Baby needs more oxygen. What are they not getting when you have an epidural? There's no reason for her to breathe harder. So that's one of the reasons why you have more fetal distress and, things like that. So we're not going to, the class is not about epidurals and bashing, unnatural childbirth and things like that. What we're going to do is we're going to spend as short a time as possible just focusing on how to get through the hardest part of labor. Because anybody can get through early labor, so we'll talk about it for about 5 seconds and we'll move on. Okay? We're not going to talk about breastfeeding, we're not going to talk about baby care and things like that because that's another video. But right now, we're going to talk about that one thing that every pregnant woman, with very few exceptions, is scared to death of. And that's the pain of childbirth and not knowing if they can do it. More women have epidurals because of fear than anything else. It's not so much the pain because anybody can do one contraction. And all you have to do is one at a time, right? My sister, who is a labor and delivery nurse for 12 years and now she's a dentist. Imagine that. Anyway, she's a labor and delivery nurse for 12 years. She told me that more women get epidurals for their husbands than they do for themselves. Natural childbirth is something that anybody can do if you want to do it. If you're willing, if you have the right attitude, and you don't even have to be prepared if you know how to tune into your body and go with what comes naturally. But if you are prepared, that gives you one advantage over anybody else, and that's confidence. Confidence displaces fear. Believing in yourself displaces fear. So women who end up with epidurals, who wanted to go natural, what's happening is they're afraid. They feel the pain, and it scares them because they don't know what they're going to do with it. And then, when you're afraid, what do? You tense up. When you tense up, the pain gets worse. It gets unbearable. When the pain gets unbearable, it scares you even more. So you tense up even more, and then the pain gets more unbearable, and you have this vicious cycle until finally the woman is screaming for her epidural, and how come that doctor isn't here yet? Now, if you replace that with confidence, relaxation, and knowledge, then you don't need that. A midwife can see when you're starting to get in that cycle, and she can stop it and reverse it. So, very first thing you need to know, just like the weightlifter and the runner, what is the benefit of the pain? What's happening? What's happening when you're moving, when you're lifting those weights? You're tearing the muscle fibers. You're damaging the muscle fibers, and so what happens is they repair themselves and they get bigger and stronger. When you're running, when you feel the pain, you're getting faster. Your heart's getting stronger. So they know the benefit of that. I've learned that I have to go over everything as if you're in second grade. Okay? So forgive me if I talk down to you when I'm saying, this is the bladder, that's the rectum, okay? Because you would be surprised some of the things that I've heard in my life as a midwife. One example, baby's out on the mom's chest and she says, when's the little bag of water going to come out? And I said, what little bag of water? She goes, you know the little bag of water that the baby pees into. I'm like, anyway, I had to explain to her about the amniotic sac, but she thought there was this little bubble, kind of like a little thing, that little toilet that the baby pees into, and that was the bag of water. Well, it is true that the baby pees into the bag of water, but that's not exactly what it's for. You know, that's just one of its things that happen in the physiology of growing a baby. Another thing was, a woman came in and she was complaining because the baby kept yanking on the umbilical cord and she can feel her belly button going in. She really thought that the umbilical cord was attached to the other side of her belly button and then attached to the baby. And every time the baby would yank on that umbilical cord, she could feel her belly button going in. So, I'm going to assume that you know nothing, because I thought both these women understood childbirth. I did. Okay. This will be a very quick anatomy lesson. Okay? Alright. This is the bladder. This is the rectum. This is the vagina. I want you to notice how the rectum runs parallel with the vagina. The bladder and the rectum are very important things to know when you're having a baby, okay? Here's the pubic bone. Here's the sacrum. There's the prominent arch of the sacrum there. And this distance between here and here is the distance that we want to be at least 12 centimeters for you to have a nice, good, adequate pelvis. On the side, if we were looking at the woman, you know, cut in half the other way, we'd see these little spines that come out on either side called ischiospines, and I'll show that to you when we bring out the pelvis. Anyway, one thing worth mentioning. This head is going to come down through this vagina. Now, if there's anything in this rectum, do you think you're going to be able to hold it in while the head is passing through that vagina? Don't try. It's impossible. If you try, you're going to keep this little guy from coming out. Midwives and doctors and anybody who does birth has seen poo before. And if you're female, you probably have pooed before when you've had a baby. I've had 8 children, so I guarantee I have pooed while I was having a baby. So don't be afraid to poo in front of me, because I pooed in front of my midwife and my doctor, okay? It's very, very important to mention that in childbirth classes. I saw an Oprah Winfrey show one time. Well, my midwife didn't tell me that I was going to poo when I had a baby. And she never wanted to have another baby. This was a show about women who had one baby and never wanted to have another baby. Isn't that sad? That she would not have another baby because she pooed. So poo is poo. We all do it. It's great. Just don't worry about it. If it's me delivering your baby, it'll be out of sight before anybody sees it. And the only way I'll remember who pooed and who didn't is the ones who make a big deal about it. So if you don't make a big deal about it, you don't mention it, I won't remember that you did. Promise. Okay? All right. So you feel that urge to have a bowel movement? Go with it. That's a good urge, and a lot of times that's not what it is. A lot of times it's the baby's head that's giving you that urge. Okay, right here is the cervix. Now we talk about dilation and effacement. You see how long this cervix is right now? Okay, you cut that cervix in half there, that's 50% effaced. Cut it in 3/4, that's 75% effaced. Take it all the way down, that's 100% effaced. There's nothing hanging down here at all. All you have is just a thin line of cervix here and a thin line of cervix here. That's 100% effaced. So as you're having contractions during the latter part of your pregnancy, and maybe throughout the whole pregnancy, who knows? I mean, we have contractions throughout our whole pregnancy and even when we're not pregnant. But this begins to thin. And it's usually in the latter part of pregnancy that we start to notice that it's thinning. It softens and it thins. And there's a lot of things that have to happen during, in order to bring a baby out. One of the things is the cervix has to get paper thin, so it's just a fine line. The cervix also has to open to 10 centimeters, and 10 centimeters means anything that is where the cervix is completely out of the way. Now if a woman tells you, well, I had a baby at 8 centimeters. I don't care who got the ruler. I don't care if it's 8 centimeters. If it's out of the way, it's 10 centimeters. For some, that may be 12. For some, it may be 8. If the cervix is out of the way, it's 10 centimeters. Do we measure exact centimeters when we're measuring on vaginal exams? No, we don't. What we're measuring is, first of all, how open are you? To about 5 or 6 centimeters. And then we start subtracting what's left of the cervix. So if there's 1 centimeter left of the cervix all the way around the baby's head, that's 8 centimeters. If there's half a centimeter left all the way around the baby's head, that's 9 centimeters. So that's what we start doing. It's not an exact measurement. It's an estimate. And quite often, you know, you might get nurses and doctors and midwives that disagree on how many centimeters dilated it is. It doesn't matter. Okay. Okay. You can see where this bladder is, all right? A head's going to come down here. How do you think this bladder is going to fare if it's full of urine? So we have to keep the bladder empty during labor. If you don't, a full bladder will keep the head up high. So keep the bladder empty, and especially before you birth the baby, you want that to be empty. If it's full, sometimes these bladders can get full and the head can come down and it can pinch it off right here to where you can't empty your bladder, and then you get this big bulging bladder right here. And the mom can't relieve herself because there's a head pinching it off. So that's why it's important to just, some women just sit on the toilet the whole time and it's great. You can do whatever you want. Baby comes out, you know, bowel movement, urine, everything just comes out and it works really well. Okay, so you actually have, right around the baby here, you actually have 2 layers of bag. One is called the amniotic sac, that would be the inner layer, and the outer layer is the chorionic sac. There's 2 layers. You know, actually, one can break and the other one not. So we have to break through 2 layers. A baby has to break through 2 layers for that water to come dripping out. Sometimes it can break up here. Usually it breaks down here at about 8-9 centimeters. Right before the baby comes out just like a wave, you know, like a body surfer. It's usually what they do. Okay, this is the placenta. Good position for the placenta. Lately, with early ultrasounds, quite often we're seeing placentas down here, and the doctors tell the woman, "Oh, you've got a low-lying placenta." She's only 6 weeks. You know, she's only 12 weeks. What do you mean she's got a low-lying placenta? This has to grow all the way up here. And don't you think as it's growing and stretching, that placenta is going to move its way up there? Now, when they say the placenta can move, placentas don't crawl along the edge of the uterus. The uterus just grows and the placenta moves up. So I had a woman go in for an ultrasound one time when she was 6 weeks away. The doctor said, "You've got placenta previa, but there's a real good chance your placenta will move." And she came back and told me that, and I said, "If you had placenta previa at 34 weeks, it's not going anywhere. You still have placenta previa." I said, "You don't have placenta previa." That particular doctor just happened to be wanting to scare her, that's all. She didn't have placenta previa, and she had her baby at home just fine, there was nothing. And we actually did, just to make her feel better, send her in for another ultrasound right before the baby was born, and sure enough, placenta's way up there. Isn't that amazing? That it can be down here, 6 weeks later, it just crawled its way up there like a little centimeter up there where it was supposed to be all along. Okay, you've got a lot of intestines are getting squeezed there, your stomach's getting squeezed. You guys who are far enough along know what that means. And have you ever heard of taking castor oil in labor? It moves these placentas, or these intestines, and gets them all upset, and somehow that gets the uterus all irritated and upset as well. So that's how castor oil sometimes can put people into labor when they're overdue. Okay, let's get the pelvis. Anybody need a break? You okay? Okay. Here's the pelvis. Now here's what I was telling you about. See, you've got this prominence right here of the sacrum and the pubic bone, and that should be about 12 centimeters. This is a gynecoid pelvis, so it is about 12 centimeters. Right here we have 2 little bony processes sticking out that are called the xiphoid processes. You ever heard of the word xiphoid on any other part of the body? Yep, right at the bottom of your sternum is a xiphoid. So they stick out. Now these are really important little things in childbirth. Some people see them as obstacles. Some people see them as annoyances. Those dang xiphoid processes are in the way again. I would not take those out of the pelvis for anything, because this is what they do. Can you see this smooth surface on the pelvis right there? Okay, there's a little slide. And as the baby's head comes down, it hits that xiphoid process and it makes it rotate down that slide. So it's a little pivoting point, is what it is. This right here, cartilage, and sometimes that gets really sore at the end of pregnancy, that cartilage as it's spreading. There's also some softening and spreading that goes on in these joints here, the sacroiliac joint. In pregnancy, our body produces relaxin, which is a substance that causes all this to relax. there is relaxin in sperm, by the way, which actually helps the cervix to soften in the later part of pregnancy. So let your husband help you. It's important. Okay, so the baby will enter the pelvis quite often a little bit posterior. And in the later part of pregnancy, if we do a vaginal exam, one thing that I'm looking for is where is the cervix? You know, you have this head coming down, and right here, you've got that head coming down, and for that baby, or for that mother, the cervix is way to the back. This is quite normal. See that? So if somebody is examining her, sometimes this head will come down right here, and that's the first thing we feel is the head, and then we got to go behind the head. Let's say this baby is engaged. Engaged means the head is down at the level of the xiphoid processes. That's engaged. And usually that's about 5 centimeters from the opening of the vagina. So about 2 knuckles. So, if you're doing a vaginal exam and you feel this head down here, and sometimes you have to reach behind and you feel the cervix way back there. And I've seen heads that are down so far that you can't even get around them with your fingers to feel that cervix back there. I'm pretty sure a woman's not going to go into labor if her cervix is back there. It's not until that cervix moves forward. It needs to move forward. This needs to be at least 75% effaced. There are exceptions to every rule. Okay, so I know you're thinking, well, my little Aunt Martha, you know, she went into labor and she wasn't effaced or dilated at all. Okay, there are exceptions to the rule. But generally, I'm looking for effacement, 75% effaced, and the cervix forward right here behind the pubic bone, squishing the bladder, of course, and we're also looking for descent of the baby's head. Want the baby's head to be down here by the xiphoid processes. So they enter in a little posterior, and when they're posterior, the back of their head kind of tends to keep the cervix back behind the head. As the baby starts to rotate and go down into the pelvis, the cervix will come forward because of the angle of the head. The little pointy part on the back brings the cervix forward. Now, a first-time mom, because she's got stronger abdominal muscles, the baby's going to move its way down into engagement usually about 2 weeks before the baby's born, and there's exceptions to every rule. With a mom who has had several other children, the baby will usually move its way down about 2 days before, and there are exceptions. Today, the mother giving birth, the baby was sitting right up here on the pubic bone until the water broke, and then it came down, and that was her first baby. So, baby's entering slightly posterior, moves its way around, and now by this time we're probably in labor. By the time the baby's head gets past that xiphoid process, we're in labor. The contractions, the uterus is, as it contracts, the upper segment gets thicker and thicker and thicker. And this down here gets thinner and thinner and thinner. That's moving the baby down into the pelvis. That's what that's doing, and it's opening up the cervix. So this little baby's coming down into the pelvis, and the cervix is holding her back. It's kind of in the way. But if her head is applied to the cervix, that cervix will open up pretty quickly. Usually a mother will take quite a long time getting to 4 or 5 centimeters and then go very quickly to 10. So these rules of you got to dilate 1 centimeter every hour, I don't know that I've ever seen. I'm sure I have seen that before, but it's not normal. What's normal is to take forever to get to 4 or 5, to linger there for a while, and then, and while it's lingering there, the uterus is thinning out down here and thickening up here to bring the baby down. When it gets to that point where it's done that, then all of a sudden that cervix will pop open. really, really quickly, and the baby will come down through it. About that point where that cervix is just about ready to pop open, a lot of times women will get little urges to grunt or to press down on their baby, to bear down a little bit. Well, what they've always told them is, don't push until you're 10 centimeters. Well, if they don't push until they're 10 centimeters, if they can't push till they're 10 centimeters, why are they getting that urge to push? Why is their body telling them to? How many women are in hospitals in complete agony because the nurse is telling them, don't push, you're not 10 centimeters. That was me on my first baby. Don't push, don't push, don't push. I'm like, I can't help it. And I'm kind of a feisty little thing. I mean, I was one of the middle kids in a family of 11, and I hated people telling me what to do. In fact, when they told me what to do, I would purposely do the opposite. And that's what I did with that nurse. I said, I'm pushing. And I pushed. With my first baby, I took forever getting to 4, probably about 8.5 hours to get to 4. And then went from 4 to 10 in half an hour on my first. Very, very common. So, okay, baby makes its way through the pelvis, it's coming down, and starts to rotate, and when it is crowning, sometimes it'll actually keep rotating in that crown. But about the time it's getting ready to clear the perineum, it's facing down. And why do you suppose it would be facing down? It's because the pelvis has more room this way on the entrance and more room this way on the exit. Plus you have these ischial spines that are in the way. So once the baby gets to this point, comes down in here, gets to the ischial spines, it stops. Because that's an obstacle, gets in the way. But look at this. What are those ischial spines doing? They're forcing the baby to turn like that. It's a pivotal point. So now the shoulders are here. Babies are shaped perfectly for coming through pelvises, or the other way around. Pelvises are shaped perfectly for accommodating babies. The male pelvis isn't, because the male pelvis, these ischial spines are too close. This is too narrow right here. It's a little bit flatter. So it's, yeah, this is a girl pelvis. This is a good kind. Wouldn't want to see you guys having babies. It just wouldn't be fun. Okay, so baby comes through, crowns, comes out, head comes out, and now the shoulders have got to go through that exit of the pelvis where that is more room this way, and so the baby does what's called restitution. So it starts out this way, turns like this, comes out, turns like this. That's called restitution. And sometimes they'll kind of turn a little bit up like this, and then they'll go back down. And then the shoulders come out, usually the top shoulder, unless you have a dad that's holding the baby like this and not letting that top shoulder come up. But at this point, the baby's head drops down, see the top shoulder, and then as soon as that top shoulder's out, the baby just squirts out like a wet noodle. Any questions about the process of birth? All right, different stages of labor and delivery, of birth. There's a stage that is not talked about very often, and it's called the prodromal stage of labor. Has anyone ever had that kind of labor where you're contracting almost every night and you think that you're in labor and you just about call your midwife and then it stops when you lay down and go to sleep? But as long as you're walking, it keeps going. Anybody ever had that happen? Sometimes that can go on for a couple of weeks. Seems like every night you sit down for dinner and you start having contractions. Oh good, oh goody, oh goody, my baby's coming. And then you know prodromal labor because it doesn't progress. The contractions are just the same every time. They're just the same until finally they just start piddling out. And you walk faster and you can get them back up to just the same, but they're never going to progress and get harder. Very, very frustrating. Sometimes can cause a lot of lack of sleep because the mother's getting excited thinking she's in labor and counting contractions, and then it stops. Have you ever heard the story of so-and-so was in labor for 2 weeks? Nobody's in labor for 2 weeks. They would pop if they were. And that is an honest truth. They would pop because as this lower segment of the uterus thins, remember I told you it gets thicker up here and it thins down here? If you're in labor for a long, long, long time, that'll thin and thin and thin until next thing you know, you've got what's called a Bandel's ring. Right here, the belly will indent. You see a Bandel's ring in my profession, and you know a uterus is about to rupture. And eventually that uterus will rupture. So nobody's in real labor for 2 weeks, but prodromal labor, yes. And prodromal labor is wonderful because it doesn't hurt. A little crampy sometimes, you know, little uncomfortable. I think it hurts more that it stops. I think that makes people more upset, is that it stops. But it's softening the cervix. It's pulling up. It's strengthening the uterus. It's getting you ready for labor. It's effacing you. It can also be called effacement labor. So it's really, really important part of labor. The more children you have, it seems like the more prodromal labor you have. And I remember specifically on my 5th baby, didn't even know when I was due, but prodromal labor for 2 or 3 weeks, almost every night. And I kept thinking, is this it? Is this it? Well, when I really did go into labor, by that time, I had resolved myself that I'm going to be pregnant for the rest of my life, and this was not real labor. So I'm going to ignore it. I'm not going to time it. I'm not going to give it any attention. I'm just going to ignore it because I'm mad at it. And so here comes these contractions again. They felt exactly the same as prodromal labor, except one difference. I was nauseated. That's how I suspected I was in real labor. And I mean, eventually the baby had to come out. I knew that. So eventually it had to be real labor, but I was nauseated. That was the only difference. And then all of a sudden, because I had so many days of prodromal labor, I'm getting ready to go to church. I'm getting my kids ready. I had 4 little kids. I was getting the toddler in the bath, and I was going to go to church because I knew this was just going to be, you know, I'd have plenty of time. And all of a sudden, boom, labor hit. And I dove in that bathtub with my toddler, started brushing the water on my tummy and yelling for my husband, and called a midwife. And I had already called her that morning and said, I don't feel very good. I think this is probably going to turn into something. So the difference between prodromal labor and real labor, prodromal labor doesn't make a baby come. You go to sleep, you wake up, you're still pregnant. That's prodromal labor. Real labor, it progresses. Eventually it starts getting painful and more painful, and a baby comes. Sometimes when you've had a lot of children, that prodromal labor is so tricky that you just can't tell the difference until sometime too late. I mean, by the time I called my midwife, she lived 35 minutes away. She got there in 20 minutes, and baby was born 5 minutes after she got there. By the time I knew it was real labor, it was almost too late to get my midwife there. So, and that's good, right? Okay, so you have prodromal labor. Go ahead.
Is that what other people call Braxton Hicks contractions, or is that different?
No, it's different. Braxton Hicks contractions you're going to get throughout the whole pregnancy. And yes, Braxton Hicks can soften and start to pull up on the cervix a little bit. That's when they start to get kind of crampy at the end. But usually Braxton Hicks don't have any pain. And what Braxton Hicks are doing is they're actually increasing blood flow to the uterus. It's like any other muscle. If you don't exercise it, when you need it, it's not going to be worth anything. And the body, how do you go out and exercise your uterus? You can't go out and exercise your uterus. There are no uterus exercises. So Braxton Hicks is the body exercising the uterus for you and getting it prepared for pushing a baby out. It takes an awful lot of strength to push a baby out of that little tiny hole. And that's why we get that Bandel's ring and the ruptured uterus in the extreme cases of labor going forever, being ignored, and with Pitocin induction. Did you know there's a certain legal level that they can bring that Pitocin, and they can't go any higher, because if they do, they're risking rupturing your uterus. So usually that comes with, well, it's because the baby isn't fitting through the pelvis. And so the woman just keeps contracting and contracting and contracting. Thank goodness we have C-sections nowadays for cases like that. But yeah, Braxton Hicks is different, and I love them. I think they feel good. You know, it just seems like every time I bent over to pick up a toy, I'd get a Braxton Hicks contraction. So next we progress to real labor, early labor. Early labor is when you're having regular contractions, usually anywhere from 5 to 15 minutes apart. They're short. The rule of thumb to know the difference between real labor and false labor, or prodromal labor, I would say, is that the amount of pain that you're feeling with that contraction should correlate with the length of the contraction. So if you're having a 20-second contraction, it shouldn't be very painful, but a little bit painful, okay? If you're having a 2-minute contraction, that should be the top of pain, of the pain scale. That should be as painful as a contraction gets when it's 2 minutes. So if you're having a contraction that's 2 minutes long and it's only a little bit painful, it's probably not real labor. In fact, I can guarantee you it's not active labor. That doesn't mean it can't turn into it, but at that point it's not active labor. Okay? So, yeah. Anytime somebody calls me and says, I think I'm in labor, I always ask them, does it hurt? Does it hurt? Well, not really yet. Okay, I don't think it's real labor. Real labor hurts. If it doesn't hurt, it's probably not real labor. Now, it could become that, but I don't say you're not in real labor. I ask them a lot more questions. I'll ask a lot of questions before I say, I think you better go back to sleep. So, okay. Active labor is usually dilation between up to, you know, early labor usually takes you up to about 3 or 4 centimeters. Active labor takes you, you know, like I say, at 4 centimeters it starts kicking in and getting hard. Takes you about 7 centimeters. And from 7 centimeters on is where we have transition. Now that's the textbook teachings. I've seen transition start at 3 centimeters. I've seen transition not start until 10 centimeters or 9 centimeters. So there's no rule that way. But the way I judge where you are in your labor is just by how painful your contractions are and how your labor's going. If I want to write on my chart, I usually write on my chart, labor is mild, early labor, mom's handling it well, you know, contractions are this far apart. And then as labor progresses, I might say labor is getting harder, labor is becoming more intense. Transition, I might just put transition. Maybe I'll put labor is brutal. And I always mention kind of how the mom's dealing with it. So these descriptions, you can describe labor many different ways, and they're all appropriate. Like maybe you'll never have brutal. Maybe you'll just get intense. You know what I'm saying? Maybe you'll have brutal the whole time. So it just depends on what's going on in their labor. Okay, transition. This is the one that we all care about. This is the one we're all afraid of. And this is the one that we don't like. It's not fun. I don't think transition is fun, do you? It's just, yeah, you think it's fun. It's not fun, but there is an element of excitement to transition. Can anybody think what could be exciting about transition? The baby's coming. So if we focus on the baby's coming, then we can actually enjoy transition, can't we? If we really pay attention to what's happening. And this is what I try and get women to do in childbirth. Focus on your cervix. Feel the baby coming through it. Feel the baby opening your cervix. Feel the contraction pulling up on your cervix. You feel that pain? That pain is your cervix opening. And if they know that the pain is the cervix opening, they're like, oh yeah, I love this pain, because cervix opening means baby right here. And that's the moment we're all going for, is that moment when the baby is right there. When you have an epidural, there is no explosion of euphoria. I'm sorry, epidural moms, but you can't convince me that you have the explosion of euphoria until you try natural. There's a term called opposition in all things. Now, there's also a very well-known scripture in the Bible. There's a time and a season for everything, right? And it starts to describe different opposites. A time to sow, a time to reap. A time to, what are some more?
Live and time to die.
A time to live and a time to die. It describes different opposites. These opposites are all an important part of having joy in this life. If we don't experience the sorrow, then we don't understand and appreciate the joy. The Lord said to Eve, "In sorrow shalt thou bear forth children. Nevertheless, thou shalt be preserved in childbearing." I remember being at a birth as an apprentice, and there was a lot of women at this birth to witness the birth of this baby. And one of the women said to the woman in labor, "You have Eve to thank for this," in a derogatory way. And that really sat in my mind for a long, long time. As I continued to watch women and help women through labor and experience labor myself, I kept hearing that woman say, "You have Eve to thank for this." And the more I experience and the more labors I attend, the more I realize that we have Eve to thank for this. Because if we didn't experience that intense depth of sorrow during transition, then we would never have that explosion of euphoria, which is the most, I remember when I gave birth to my first baby. It was natural. Natural was very vogue back then. If you had an epidural, you were very looked down upon, and you couldn't go to the natural birth people's parties. You had to be cool, okay? So I had natural childbirth because I wanted to be cool. I wanted everybody to like me, and I wanted bragging rights. Nowadays, it's not bragging rights. It's you're crazy. And they have their own epidural people parties, don't they? And you're an outsider. That's why I have those classes every month, so we can have our parties. Anybody heard the story of the Sneetches? Starbelly Sneetches? Yeah, that's one of my favorite stories. But anyway, we have our Frankfurter parties. They can have their beach parties. So it was vogue. I had a natural birth, and I was not prepared for what I was going to get that day. When that baby came out of me and they announced that it was a girl, And back in those days, the baby didn't go into your arms. I can only imagine I probably would have blown up with joy. My heart would have exploded with fireworks and joy if they had just given me my baby. But just the fact that I brought her out of my body and felt every bit of it, and then all of a sudden, I'm a mother, and I have a daughter, and I didn't get to see her, which is a crime, which is why I do what I do, because I don't want anyone to go through that. She went into the nursery, but still, the joy that I felt was overwhelming. I had never experienced happiness like that. And I had a very happy life. I had a happy childhood. I had a happy adolescence. But I had never experienced that kind of joy before. It was just amazing. Would I have experienced that much joy had I had an epidural? An epidural mom would tell you yes, but has she ever experienced the other? That's my question. So, anybody need a break yet? Do you? Okay, go take a break. I lost my train of thought. It's time for break.
I've only got about 11 minutes worth of battery left.
Okay, turn it off.
Yeah, maybe I can charge it with
There's
a break.
water over there, and okay, the dreaded transition. After the dreaded transition, and we never really know when transition is going to end, but when it ends, you know it. Because all of a sudden, that cervix slips over the baby's head and the baby comes through it, and no longer does that cervix give you any pain. If you tune into that and feel that, it is probably, besides the part of the baby coming out and labor being over almost, it is one of the points of labor that comes with intense pleasure. The pleasure of that pain being there, and all of a sudden it's gone. And you've been doing everything you can to deal with it while it's there, and all of a sudden it's gone. It's finished. You've crossed the finish line in dilation, and the pain is no longer there. Now, the way you're not going to feel that is if you allow yourself to be afraid of second stage labor, where your body all of a sudden goes into action, your uterus goes into action, and the contractions change. And now the contractions are starting to push, so strong that you feel like bearing down and not stopping. Now before that, you will get little urges, most likely, to press down on the baby, to drop your baby, to grunt maybe. It's very, very common. I don't very often see a mother in labor who doesn't start getting little urges where they'll say, I think I have to push, or I think I need to have a bowel movement or something. And almost always, they're not 10 centimeters. Very rarely do I not see that. But anyway, when you are 10 centimeters, if the baby is down far enough like it's supposed to be, you'll start getting really strong urges to push. Those strong urges to push, all of a sudden, you feel, if you do it the wrong way, you'll feel completely out of control. You'll feel like your body's taking over and you want to throw your head back and arch your back and stop this process from happening because it scares you. So we're going to go into, when we go back over the different stages of labor, we're going to go into what to do at that point to actually enjoy second stage labor. I love it. I love when I get that urge to push. It feels so good to me. And for most people, it does feel good. And we want it to feel good, don't we? We don't want it to hurt. So that's why we're changing everything and showing what is the positive in the opposition. What's the positive in feeling pain and in feeling hardship and things like that? Can you actually learn to enjoy the hard parts of life? You can if your focus is here and not there. So that's what we're doing in childbirth too. We're going to focus here. We're going to look to the finish line and focus there and enjoy the journey along the way. So after you get to 10 centimeters and you're pushing the baby out, that process just goes without saying. We all know what happens. The baby comes out, right? And I described it when I showed you the baby in the pelvis. After the baby is in your arms, there's a third stage of labor. And usually there's a lull between first stage and second and third. And probably third, and third and fourth. There's a lull as well. There's a little bit of a break. Once you start feeling, once your cervix gets totally dilated, quite often there is a lull between full dilation and when you start getting the urge to push. And then after the baby's out, there is a little time period where you're resting and you're enjoying that euphoria without having any other sensations interfere with that. Now, between 5 and 15 minutes after the baby is in your arms, sometimes sooner, just these are textbook rules I'm giving you, no rules. I love the philosophy of no rules. That's just me. That's the kind of person I am. But there are no rules in childbirth. And when you get to that point, you're holding your baby, and the baby should be right here. The baby should not be over in a warmer. Should not be off in a nursery like mine was. For dang sure. Should not be there. It shouldn't be in Dad's arms. Sometimes dads say, I want to be the first one to hold my baby. Oh, okay, honey. No, don't do that, guys. It has to be in her arms. It has to be. It's very, very important. And you need to be there too. Just get in there and be a family. But it's got to be in her arms because she went through that labor and she's got to make a connection between that baby that was here and the baby that's here right now. She's got to make that connection if you want her to have every advantage of motherhood that she can have. So the baby comes here and she's holding the baby, and first she's probably pretty exhausted. Sometimes she's not going to look right at first. She's very, very exhausted. So it's good that we have that break and that lull to kind of catch our breath, get back to focusing. And okay, now what just happened? Oh, I have a baby. Okay, let's look at him. Oh, he's cute. Okay? So now you're coming back to reality. You're coming back to earth after going into outer space with pushing this baby out. Now what happens about this time is from your pituitary gland, there is a big surge of oxytocin. Now oxytocin surges through your body throughout labor. That's what's causing your uterus to contract. There's a lot of new research done with oxytocin. It's the love hormone, and it's just amazing some of the things that the scientists have found out with oxytocin, to the point where on the internet I saw the other day they were having an oxytocin party. Passed a plate of oxytocin around to all the guests at the party. Next thing you know, everybody's hugging each other and just, oh, I just love you, I just think you're so neat, and all this stuff. Really, it's the love hormone. And they've actually taken rats and, give oxytocin to 2 boy rats, and all of a sudden they're gay. They've actually done that with studies. So it really works. Well, the best oxytocin is the natural stuff that comes right out of your brain into your bloodstream when you have the baby. The alternative in a hospital when you get an epidural, because the epidural slows down the flow of that oxytocin, they have to give you Pitocin. Pitocin is artificial oxytocin. That Pitocin goes into your bloodstream, and it doesn't cross the blood-brain barrier. So to have the advantage of the Pitocin, like oxytocin that's actually released from your brain, is like night and day. You don't get the same benefits with the Pitocin. That's one of the biggest reasons, I think the biggest reason, why natural childbirth is so important and so superior because you get that oxytocin, the love hormone. The oxytocin is released because inside your body you've got this placenta, okay? That placenta, this is the biggest miracle of childbirth. That placenta is hanging on to the wall of the uterus for 9 months. Well, it's not fully developed right at first, but you know what I'm saying. The whole pregnancy, that placenta is hanging on. It's the only lifeline your baby has. Without that placenta, the baby will die. And it's hanging on. And almost everybody goes through the whole pregnancy with this placenta hanging on, and all of a sudden the baby's born. There's this surge of oxytocin, plus a decrease in the size of the uterus, that helps, which gives your uterus this huge contraction. And as a midwife, we see that little flow of blood to know that the placenta has released. It releases the placenta. It shears it right off, just like someone took a spatula to, and it didn't do that the whole 9 months you're carrying the baby. That's a miracle to me, that it knows exactly when to come off. So it comes off, and then the placenta is delivered, and then we go through 4th stage labor, which most first-time moms won't feel 4th stage labor. But those of us who have had babies before, we know what 4th stage labor is. Sometimes we complain it's worse than labor, and that's what we call the dreaded after pains. Good thing about after pains is you can actually take Tylenol or something for them if you want. Okay, psychological stages of labor. Nobody talks about the psychological stages of labor, but I have witnessed this as a midwife, and there are definite psychological stages of labor. First of all, we have what I call, oh, you know what? I should back way up. I should back up the psychological stages of labor start in pregnancy. About 7 months along, the mom comes in, very common. She comes in and she says, I'm scared. I'm really scared. It's between about 7 and 8 months. I just don't know if I can go through labor again, or I don't know if I can go through labor, and I don't know what to expect. And they actually come to me with these pleading eyes, help me. I don't know what to do. And they're having second thoughts about this natural birth idea. And I always tell them, relax. This is normal for you to be afraid of labor right now. It's not time for the baby to come. But I promise you that when the time comes, you'll be ready. Not only will you be uncomfortable, but you'll be ready and you'll enjoy that pain. You'll welcome the pain. So that actually starts. That's the fear phase, right? And then they get to the end, and they get to the point where they say, "Okay, I'm ready now to have my baby. I'm ready." And then they start. Once they get ready, then they start getting very impatient, because every day after that is a year. So you're waiting, you're waiting, you're waiting. It's like waiting for that Hawaiian cruise that you've been planning, or Christmas. You're waiting, and you even have the Advent calendars where you're marking off the day, right? Well, then comes the next phase, and that's the Christmas morning or excitement phase, the birthday phase, the it's finally here phase, vacation is finally here, Friday, thank goodness it's Friday, that's the phase. You get excited because now you're having contractions and it's real labor. And Dad's just so excited because he says, when can I call the midwife? When can I, now? Can I call her now? And he's so excited because that's his job, to call the midwife. And everybody's excited. And then you're going to sit down and you're going to watch your favorite movie that you've been saving moment. Where you're going to sit and watch this movie, and you're going to time contractions. You've got your little notebook, and you're going to start writing down contractions. Some people even have a contraction counter app on their phone or their iPad. And they're going to count these contractions and write it down for future posterity to look at. People make big mistakes during that excitement phase, because that should be the storing your nuts phase, where you're storing up for a long winter. But instead, they're using up all their energy, timing contractions and watching the movie and staying up Oftentimes, labor starts late at night. It's real common it starts about 11 o'clock at night, but contractions are far apart at this point. They're mild at this point. What better time to store up for the long winter, go to sleep, get something to eat, drink a big glass of water, lay down, cuddle with your husband, and go to sleep. It's the best thing you can do at that point. Okay, so you've gone through this excitement phase, you timing contractions. If it's during the day, you don't always go to sleep, but now the contractions start to hurt. And then I have what's called either the whoa stage or the oh yeah stage, depending on whether you've had a baby before. If it's your first baby, it's the whoa stage. Like, what did I sign up for? What is going on? How much harder is this going to get? Am I going to be able to do this? This really hurts. I don't like this. And then you start wondering why you were hoping for labor to start for so many weeks. The oh yeah phase, it's like, oh yeah, now I remember what labor feels like. Why in the world did I let my husband do this to me 9 months ago? And I remember thinking in labor, am I a sadomasochist? Do I love pain? Why do I keep doing this to myself? Now, an epidural was never an option for me because I was too afraid of epidurals, but I'm just one of those people that's kind of afraid of any kind of intervention or drugs or things because I know they all have side effects. I'd rather just do without them if I can. But it's the, okay, we get past the oh yeah and the wow phase, and then it escalates into a complete panic phase. You're panicked, you're running away, you don't know what to do. Some of us call that the big eye phase, where your eyes bug out and you look at your husband and want to strangle him. You go, you're not doing it right. Or you look at the midwife and you go, help me. And you don't know whether to try and relax or to scream and thrash and try and get away from it. And this is the moment where if you're in a hospital and the two have to, it's not just being in a hospital that does this. If you're in a hospital and you have no support, same thing can happen at home. If you're at home and you have no support, but at home it's different because there's no epidurals available. So if you're in a hospital and you don't have the right kind of support, you will cave at this point because you're frightened and you're tensing up and you just feel like, ah. First-time moms are thinking, if it hurts this bad, how bad's it going to hurt when I push it out? Because first-time moms usually think that the pushing is the worst part. They think it gets worse and worse and worse until the baby comes out. It's not true. It gets worse and worse and worse, and then it starts over and it gets worse and worse and worse. So, but it's a different worse and worse and worse. The panic stage. You're panicking, you're doing everything you can, and even during the whoa, oh yeah phase, you're still doing everything you can to get away from the pain. You're going to go soak in a bathtub. You want hot towels on your back. You want someone pressing on your back. You want to get in the position where the contractions don't hurt, where the contractions hurt the least. You're running away. You're trying to fight this process that's happening. When you get into the panic stage, you really start to fight it. And sometimes, oftentimes, women can end up in a big screaming ball of knots, screaming for their epidural. I don't see that very often in my business. Usually, if I do see it, it's somebody who maybe came to me at the very end of pregnancy and hasn't had enough time to build a relationship with me so that they trust me. If my client trusts me, I can get her through it. If she doesn't, it's hard It's really hard. So anyway, they fight it and they fight it and fight it. And I'm going to tell you right now, the baby will not come until you move on to the next psychological phase. I transported a girl this month because she could not move on to that next psychological phase. There was a little bit of a language barrier and things like that. So, what do you suppose that next psychological phase is? If this one is fighting it and panic, what do you suppose that is? Do you think, huh?
They're just getting into it.
Exactly. It's the submission phase. And she's fighting it and fighting it and fighting it and trying to get away from it, and hot towels and more water poured on my tummy, and come on, I need something for my head. And then all of a sudden, she realizes, now this could happen if her husband convinces her of this, or if the midwife or the doula convinces her of this. But I usually tell my client, it's very normal what you're doing to try and get away from the pain. But when you get to the point where you submit to the process and you give in to the will of what your body's trying to do, then your baby will come. And until you get to that point, your baby won't come. You'll keep fighting it. So I'm also going to teach you how to get to that point. But when you get to submission, you get to the point where you say, okay, I know it's going to hurt, and I'm not going to worry about that anymore. I don't care how much it hurts. I just want my baby. When you get to that point, you relax, you let in, you stop fighting the pain. You actually embrace the pain as your friend, because you're not going to fight it anymore. It is what it is. And it's a hoop I have to jump through to get where I want to go. So you submit. And when you submit, the baby comes out. And then the next phase is the euphoria. And complete, just complete love and joy and awesomeness that happens. And if we were to go on, some women will start going through a depression phase and after baby blues phase, but you're not going to do that, because we're going to talk about that phase and what's happening to cause you to go through that phase. Okay? So, next week, what time do you want, what day is best for you? You like Thursday? Okay. I'll be in touch with you and let you know, because I do have the daughter who has the new preemie twins, and if I get a chance to leave and go away, I will. So it just depends on whatever. Ready? Go? Okay, welcome to the second class. Welcome to the second class. Last week we talked about the anatomy and physiology of pregnancy, the end of pregnancy, and the beginning of labor and the different stages of labor, and how the baby moves down through the pelvis, how the uterus contracts. We're going to go back, start all over again from the very beginning at 9 months pregnant, 40 weeks from your last menstrual period, and imagine that you're having your baby on your due date, okay? So a couple weeks before that, things start to happen. Changes start to occur in the cervix. And somebody who understands how to read a cervix very well, who has a lot of experience examining cervixes, can pretty much predict, sometimes to the exact day, when you're going to have your baby. I can't predict any further away than a week or 2 weeks, but I can check somebody's cervix and say, okay, you're not going to have a baby this week. Or, you're probably going to have your baby in about a week, or maybe in 2 days. And there's certain things that I'm looking for to be able to tell when that's going to occur. First of all, with a first-time mom, I'm going to expect the head to be down in an engaged position. And that position, like we talked about last week, was at the level of the ischial spines, these little spiny prominences that stick out on the pelvis here. This is how a pelvis sits. So when the head's down to that level, that's called engaged. Quite often, first-time moms will engage 2 weeks before their baby is born. If it's not your first baby, it usually happens about 2 days before the baby's born. So we're looking at the level of the head. Now, there are no rules in childbirth and pregnancy, and you can defy all the odds and all the rules. That's okay if you want to be that kind of a person, okay? So the head can come down, or it can stay way up high, like my first baby did, even until I was 10 centimeters, and at that point, the head dropped down. That's possible. But we are looking for that kind of things. Before the baby can come out, it has to come down. The cervix needs to come forward. The cervix is generally sitting behind the baby's head at first, and then in those last couple weeks of pregnancy, that cervix will gradually migrate forward. Usually from contractions, right, Manjai? You having one right now? So these contractions that she's having, which is called prodromal labor, that's what's happening. The cervix is coming forward, and it's changing in consistency. It used to be believed that the cervix was an extension of the uterus. But new research has revealed that the cervix is actually made out of a completely different material than the uterus. And the cellular, down to the cellular tissue level in the cervix, it changes in the last part of pregnancy. And it becomes a very elastic tissue, where before it wasn't so elastic. As the cervix moves forward, and the head that's migrating down into the pelvis, the closer you get to your time of delivery, starts to put pressure on that cervix, you'll feel what's called prodromal labor. Sometimes this prodromal labor can feel just like real labor. The only difference is it doesn't progress to a baby like real labor does.
Your hair? I don't know.
Sorry. Prodromal labor doesn't progress to a baby in your arms like real labor does. Usually you'll have contractions that, you can have contractions that are regular, that are painful, but they don't become more painful, and eventually they'll kind of piddle out and go away. This prodromal labor usually happens in the evenings and sometimes in the early morning. But if you're not in active labor by, say, 8 or 9 o'clock in the morning, you're probably not going to go into labor until dinner time that night. Not too often do women start into labor in the daylight hours. They can, but it's not very common. So I figure if I want to run up to, out of town for something, an hour out of town, I'm going to wait until about 9 o'clock. If no one's called me, I run and I get back before dinner time. Okay, so the cervix has what feels like a drawstring around it. As long as that drawstring is there, I'm pretty confident that she's not going to go into labor until that releases. When the cervix gets to a consistency to where it feels like you could stretch it all different directions with your fingers, then that's when a woman is prepped and ready for labor. If it's tight and it's got that drawstring around it, it could be 90% effaced, but if it has that drawstring, then I'm pretty sure she's not going to go into labor. And if she does go into labor, she's going to have a lot of pre-labor before she kicks into active labor. So, all these things start happening. Women start getting excited. A lot of times they might call me on a false labor. And the questions I'm going to ask you when you call me are, how far apart are they? How much do they hurt? How long are they lasting? Do you have any other symptoms? Are you nauseated? Are you shaky? And I'll also want to listen to you while you're having a contraction. I had a woman call me this afternoon, and she was in a lot of pain, and she thought she was in labor. She was a month early. And I was pretty certain she wasn't in labor by certain clues that she gave me, where she felt her contractions. How they were hurting in between the contractions, not just during the contractions, but she was hurting constantly, and during the contractions, she was having more pain. So it was constant pain. Contractions should hurt only during the contraction, and when you're not contracting, should go completely away, with the exception of the very final stages of labor. But by that time, you know you're in labor. A lot of times, the only symptom that a woman may have is nausea and a little shaking with some mild contractions. But it depends on the woman. It depends what her cervix was like. I can also tell by examining the cervix how fast her labor is going to go. And that can help me give warning to people who live in Cedar City or maybe even across town. Just on the other side of town, it can help me give warning to them. One time I had a woman who had, a good 12-hour labor with her first baby, and with her second one, I told her, you're going to have this one very quickly. I know the last one took a long time, but this one's going to come very quickly. So as soon as you have contractions, as soon as you feel anything, call me. Don't wait. So she went into labor, and her husband said, Liz said we need to call her right away. And the husband said, no, it's going to be a while. We don't need to call her. But she said to call her right away. No, we don't have to call her right now. 2 hours later, she said, if you don't call her, I'm going to call her. So he calls me. And I said, is that her breathing in the background? And he said, yes. And I said, you called me too late. I won't make it. So I said, I'm going as fast as I can. I was throwing my stuff in the car as I was talking to him, and I said, call me when the baby starts coming. My assistant lives close. I'm going to try and get her over there before your baby comes, but I won't make it. So my assistant, who lived right around the corner from them, ran in just in time to catch this baby that fell out as she was standing in the shower. Baby came out fully enwrapped in the amniotic sac. She didn't have anything to get the sac off, had to rummage through their bathroom to find something to get the sac off, and it was just kind of a really stressful situation that could have been peaceful and wonderful. But that's to illustrate that the cervix can tell you how fast your labor is going to go. It also can tell you if you're going to have a long labor. If you're going to have a long labor, that's useful to know. Sometimes long labors are easier to handle than short labors. Short labors kind of catch you off guard, and you don't even have a chance to catch your breath before your baby's out. And sometimes that can take you for a wild ride, where you don't really have a chance to really enjoy your labor before it's over. And enjoy is what I mean. Enjoy your labor. Now, first-time moms seem to do better in labor. They don't really know what to expect. They do have the fear of the unknown, but they're very trusting in their midwife, and they just take it one step at a time because they don't really know what to expect. And it seems like the more babies I had, the bigger of a baby I got, because I not only would remember labor, but I would remember labor worse than it actually was. So it was always, I would remember the worst part of labor, and I'd get all afraid, oh no, I'm going through this again, I can't believe I'm doing this again. And then labor starts, early labor starts, I'm like, what was I so afraid of? This isn't so bad. And then I got to the very end and I'm like, oh yeah, this is what I remember. But by that time the baby's out, because I had had so many babies, the transition goes faster. So anyway, now your cervix has become fully ripe. And you're ready to go into labor. You start to have mild contractions. Now textbook labor usually starts out with mild contractions that last 15 to 20 seconds. That are about 10-15 minutes apart. That's a textbook labor. Yours may or may not do that. and it gives you a little warning. A lot of women don't even know they're in labor, especially if this starts happening at night when you're asleep. So once you start realizing, and the contractions get progressively stronger and progressively longer and progressively closer together, as this starts happening, you start realizing you're in labor. I have one instruction for that point of labor, which is early labor, and that is store up your nuts for the winter. Store up your resources. Eat, if you can, drink, and sleep. This isn't the time to go for a long hike, unless you've slept a full night and you wake up at 7, 8 o'clock in in early labor and you want to get things going. That's fine. Go for a hike if you're up to it and you have lots of energy. If it's your first baby and your midwife has warned you that the labor might take a little while, it may not be a time to go for a hike. Maybe a time to just fold laundry or do the dishes or something. But go about your daily routine. Take note of where you're at when you start your labor. When you start labor, do you have enough reserve stored up for a long haul? If you don't, then build up your reserve, because the number one reason for hospital transport with home deliveries, attempted home deliveries, is maternal exhaustion. It's the number one reason, and it's probably the number one most preventable. And I don't know how many times I tell women, build up your reserves, build up your reserves. It's not the time to wake up your husband at midnight, turn on your favorite Disney movie, and start timing contractions. And especially, it's not time to call all the neighbors and all the relatives to let them know you're in labor. If your water breaks, that's the time when you need to inform your practitioner that your water has broken. Your practitioner is going to ask you a few questions. Is the water clear? Is the baby moving? Those are the two most important questions. We want clear water and we want moving baby. And then I would give you instructions on how to keep yourself from getting an infection so that you can buy more time until labor kicks in. I'm going to instruct you not to take a bath, not to introduce anything into the vagina that's going to introduce infection, introduce germs. We won't do a vaginal exam if the water's broken and there's no labor yet. Doctors are more aggressive with broken water. That's because hospitals have dangerous germs. And once you enter into the hospital, you've now entered into the place that has the most germs out of anywhere in the world except the sanitation department. So you get in there, they want to get labor going. They give you about a 6-hour, depends on the doctor, 12-hour window. I give you a 48-hour window, as long as there's no fever or any sign of infection. So once labor starts, build up your reserve. Resist the urge to stay awake and time contractions. Nobody cares how far apart your contractions are, or anything like that at midnight. Just go to sleep. Go to sleep. Go to sleep, let your midwife sleep. Once labor starts picking up to the point where you think you might start to need some help with the managing of labor, then you call the midwife and you let her know what's going on. But hopefully you've gotten 5 minutes of sleep in between each contraction. And even if you're resting, if you can sleep, fall asleep for 1 minute, it's better than nothing. I can tell you as a midwife, staying up all night, by morning, I can't think straight. But if I can manage to sleep for 2 minutes in between this woman's contractions, then I'm a completely different person by morning when it's time to deliver the baby. So when you're falling asleep, I'm probably falling asleep. But I had somebody laugh at me one time because I was coaching her in my sleep. I was laying on the floor and she'd start having a contraction and I would coach her. I would wake up and coach her, but I keep my eyes closed and I was half awake, half asleep. Sleep is really important, even a minute or two, whenever you can grab it. Okay, so we move along to active labor. In active labor, contractions start to hurt, and you have to start breathing through them. That's active labor, that's the definition. Once you have to start breathing through the contractions and they're painful, like painful menstrual cramps, then we would consider labor active. Usually these contractions last 45 minutes or 45 seconds to a minute. And you might start getting some bloody show at this point. You could get bloody show before you even start noticing labor. Bloody show indicates that you've got 48 hours, and sometime in that 48 hours you're going to go into labor. Typically, that's textbook. Losing a mucus plug that doesn't have any blood in it, and blood can be pink, red, or brown. But losing a mucus plug which looks like somebody blew their nose on a Kleenex, it's exactly what it looks like. That can happen 3 weeks, a month before you go into labor. It's not a reason to call the midwife at 3 o'clock in the morning. Hey, I lost my mucus plug. My sister, who is a labor and delivery nurse, we were comparing funny stories. And she talked about, one of her funny stories was a lady who brought in her mucus plug on a Kleenex to the hospital and said, I lost my mucus plug, I just wanted to show it to you. So don't do that. Anyway, blood, 48 hours. That's usually the rule. Okay, so labor is starting to hurt. At this point, still try and relax. At the end of the class, we're going to do relaxation techniques. And it's really, really important that you learn to relax, that you understand, that you learn all the muscles in your body and become aware of everything, because in labor, just having a scowl on your face in between contractions means you're keeping your uterus tight. And you want to completely relax the uterus when you're not having a contraction. Okay? So early labor, early active to active labor. Relaxation. Now, what are the best positions to relax in? If you imagine a staircase, okay? And this is my pain staircase, okay? At the top of the staircase, you are a screaming ball of knots, screaming for an epidural and kicking your husband, okay? At the bottom of the staircase, you are sound asleep. Now what you want to do in between contractions throughout your whole labor, except if you're up doing your laundry and stuff like that because you've had a full night's sleep, okay? But what you want to do, especially during the hard part of labor, is you want to get as down low to that bottom step as you can, because sleep is the ultimate level of relaxation. At least it should be. Okay, so if you can fall asleep in between contractions, sleep is a natural anesthetic. So during the contraction, you will climb the steps. And in between contractions, you want to climb back down the steps and relax. If you don't, you'll climb a few steps during that contraction and maybe go down one step. And then you'll climb a few steps and then go down 1 or 2 steps. And you'll climb a few steps, and before you know it, you're this screaming ball of knots up here. So make sure, especially during active labor, that you come back down that staircase after each contraction. When do you start relaxing? As soon as that contraction starts going down and your uterus starts relaxing, follow it. Follow it all the way down. Relaxation breathing is the same breathing that you do while you're asleep. Now husbands, observe her while she's asleep at some point between now and the time she has the baby. Okay? See how she breathes. That's how you're going to tell her to breathe in labor. Most people, if you imagine an old man snoring, okay? That's the kind of breathing an old man will do while he's snoring. Now take out the sound and just breathe in deep. Now don't we breathe in very deep when we're sleeping? Don't we relax the back of our throat, which is what causes some people to snore? Everything is completely relaxed. We're breathing in slowly and we're breathing out slowly. We're exchanging air, getting lots of oxygen. That's the kind of breathing you do when you're trying to relax during labor. The Lamaze method of childbirth will teach a kind of breathing that's a deep chest breathing, where you breathe in, 2, 3, 4, out, 2, 3, 4. And you do that in early labor. When labor starts getting harder, you breathe in 2, 3, out 2, 3. When it gets even harder, you're breathing in 2 seconds and out 2 seconds. In transition, you're going in 1, out 1. And then, when labor hurts and it's the strongest it's going to be, you're going he. And they're having you say the word he and breathe through your teeth. Well, to me, that mimics panic. When somebody is panicked, their breathing speeds up, their heart rate speeds up, and they get this big-eyed look and and you know what Lamaze tells you to do about that? Bring a bag. Bring a paper bag and put it over your face so you don't hyperventilate. Why? Why hyperventilate? Why have the bag? There's nothing natural about that. I say, slow down your breathing. And when I was having my first baby, my husband and I took Lamaze classes. We had to back then in order to get him into the delivery room. He had to have a ticket that said he had completed the class, he had watched the gory movie, and he didn't faint. So now he's allowed to go into the delivery room. So we get into the delivery, or just about the time that I go to 10 centimeters and I start getting the urge to push and all this stuff, and they're telling me don't push because the doctor's not here and blah, blah, blah. Everybody, there's this scenario, I've heard it a million times. I had my paper bag on my face, and I was hee-heeing into this paper bag, and this big, hefty nurse comes in and she says, "Girl, what you got on your face?" And I said, "This is my paper bag that my Lamaze teacher told me to bring in case I hyperventilated, and I'm hyperventilating." She goes, "Why are you hyperventilating?" And I said, "I don't know, I just am. I'm breathing this way." And she says, "It's because you're breathing too fast." She goes, "Come here. Come here. You listen to me." She put her arm around me and she goes, "Breathe in. Slow it down. Slow it down." "No, this is what I was taught in Lamaze. You speed it up. You speed it up the faster labor gets." She goes, "Girl, I had 7 babies. You listen to me."